Welcome back to the second video and chapter in this series. We will continue our discussions on strategies to include trans people in NSPs, talking about the guidelines we developed for governments and activists, and the accompanying resource guide. Meaningful inclusion of trans people in NSPs is rare, and this exclusion continues to contribute to poor HIV-related health outcomes among the trans population and the comparatively low levels of trans-specific funding and programming. Accordingly, we have developed the two guides, the best practice guideline for trans activists and the best practice guide for governments, to address the exclusion gap by increasing the meaningful engagement of trans people in NSP development. The two guides are accompanied by the resource manual. In this video, we will take an overview and flip through the pages to see what you will find inside. I will also share with you how you as a trans activist can make use of the government guide and how to use the resource manual. The activist guideline covers topics such as what is the HIV National Strategic Plan? Why is it important that our organization engages with it? Holistic recognition of trans communities as key populations in NSPs. The government guideline covered topics such as the methodology of the whole project, the presentation of findings, and that is followed by the best practice and recommendations for engaging trans people. Understanding how NSP engagement links to the priorities of our communities and ensuring that language in the NSP includes this is essential. Ensure the state acknowledges the ways in which criminalization, sexism, HIV stigma, and transphobia can negatively impact risk-taking behavior. Knowledge of HIV status, HIV care, and other needed services for many trans people. As shown in the graph, the activist survey as well as the activist validation meeting made clear that the goals for trans engagement in the NSP are diverse. We looked at the responses we received from the survey in order to move forward to what trans activists globally expect their work in their country's NSP will bring them. We responded by creating these guidelines in order to better assist and equip trans activists, understanding, experience, and advocacy on country level with their NSP. The best practice for governments, we highlighted the current situation experienced by trans people in regard to HIV and trans activists and the challenges to engage with the government and structures such as the CCM, technical working groups, and the importance of including trans activists in community as one of the KPs in the country. The best practice guide for governments seek to address the exclusion gap by developing best practice guidelines that provide clear steps and appropriate language that governments can use to facilitate and foster the meaningful engagement and involvement of trans communities in the development of NSPs. They say knowledge is power. Use the information in the best practice guide for governments to your advantage. Make sure at every possible opportunity when meeting government officials, CCM or technical working group members, or representatives from Department of Health, to hand them a printed copy of the guide or disseminate the online link. Disseminate it during workshops, panel discussions, or one-on-one meetings. Given the opportunity to collaborate with government to provide content for awareness and sensitization workshops, ensure to include it in the materials. One of the key findings we learned about with the survey was that trans activists working on NSP engagement have indicated that collaboration with other KP-led organizations, networks, and actors has been an entry point to starting to hold governments accountable in this area, and have found value in coordinating work across sectors. This manual provides on a cheat sheet method some templates and examples of documents, which will help ease the workload and assist in following through with the selected recommendations to implement on a country level. It is aimed for Transnet organizations embarking to engage with their country HIV, NSP, and development in these type of platforms. The resource manual is organized according to the 9 recommendations in the activist guide. The manual includes a number of templates or URL links to click through directly to the source. Most of the templates can just be downloaded, copied with a few adjustments to include local country context, ready to use. We shared a few examples of different countries' NSPs. These are only a few country NSPs we shared, but going through them might help you to see and understand what will be in them and assess your own country considering other examples you saw. You will find the network database. Make use of it. Contact those that you are not already in contact with. Data collection in itself is a big project. You might decide to collaborate with government, your CCM or technical working group or Department of Health to do it. Or if you want to engage on this independently, to collect nationally some data, one way can be to start the whole process with scorecards. You will find the steps to develop a shadow report. And on the next page, you will find URL links to examples of a few countries' shadow reports. Shadow reporting is a collaborative effort and really not something, especially a first time, for a single organization to do. It will also carry more weight and credibility if a few organizations or even a network write it together. Even if it is across various KPIs, it might actually be stronger that way. A shadow report is really a method or a tool by which civil society reports on the gaps in the official report of their own country, hence the word shadow. Therefore, it is always a stronger document if multiple organizations work on it together and signs it off collaboratively. In the next video, Joshua will take you through step by step with a guide to assess your country's NSP. He will talk about all the sections in the NSP and what to look for. We are looking forward to see you back in the next video.